start. Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And thank you very much for this very special episode of Dr. Ashley and the Boss, because Dr. Ashley's not here. No, she's very sad about that, but we had no room for Dr. Ashley because we've got the prevention gals. We've got Leanne, we've got Chris, and we've got Wendy all in studio today. Welcome, ladies.
Thank you.
Thanks for having us.
So believe it or not, folks, we only have enough money for 4 microphones. So Dr. Ashley had to sit out, but I could tell you she cried. There was a small glistening tear that she had to sit out. But this has been one of the most listened to and rated podcasts that we do. I don't know if you ladies know that. People ask me, when are they coming back on? We learn so much about prevention in Ashland County when they're on. So people do listen to you. They look forward to this episode. And, I don't know if it's just happened naturally because you guys are just a little less busy in the summer months, but we tend to do this episode about prevention in Ashland County right before the school year starts. And once again, that's how this is shaken out. So I think that gives us an opportunity to talk a little bit about the year that was, but also to talk about some of the things that you're anticipating for this year that's upcoming, which will be the 24-25 school year. So again, let me say, Chris Hickey, Wendy Lemon, Leanne White all work for ACCADA, which is one of the board's contract partner agencies. They all have worked for ACCADA for some time. They're all veterans. They work in our districts, our school districts here in Ashland County. And I'll ask everybody to introduce themselves and maybe talk about some of the schools they're in. And then we'll just dive into some of those other questions. So maybe just seniority, Chris. I'll start with you, if you wouldn't mind. She just started. Chris is brand new.
Yes.
No, Chris,
Yes.
maybe
Actually,
talk about...
I was just figuring this out. Math's not my strong point, but this is my 33rd year with ACCADA.
Yeah.
And so I'm the senior prevention consultant on staff, and my districts are Hillsdale, Crestview, and Mapleton that I work in.
All right.
Very good.
Excellent. Wendy, are you next?
Yeah, I'm next.
All right, Wendy. Because of seniority, I wasn't sure.
I have 8 years. This
8
will
years?
be my 8th year.
Okay, wow,
year.
that's flown by.
Yeah, it really has. It's gone
You had
very
just
fast.
graduated high school, I think, when you first started. So this is just give people an idea.
I truly did just
Yes,
graduate
you
Yeah,
college.
yeah,
that's true.
yeah, you really did.
Well, Wendy, which districts are you in?
I am in the Loudonville-Perrysville district and
Loudonville-Perrysville.
also Ashland City.
Okay.
Leanne and I are both sort of in both of those schools. I do the younger ages. So I have McMullen and
Okay.
Bud, kindergarten
McMullen,
through
Bud.
6th grade.
Okay.
And then here in Ashland City, I have done kindergarten through 8th grade for 6, 7, and 8 has been half the year. So I have traditionally done the first half of the year.
Okay.
And then Leanne does the second half.
All right. Leanne White.
Yep. So as Wendy was saying, I have done 6th, 7th, and 8th in the spring. I also do 9th grade at Ashland throughout the whole year. And then I do 7th through 12th at Loudonville.
Okay.
And I'm also in the Career Center.
Excellent.
Yeah.
So hopefully the audience knows. I wanted everybody to kind of know what buildings and districts you were in case they have questions, about the services. But I believe most of the districts at the beginning of the year, a lot of information, maybe too much information, a lot of information goes home with a lot of the youngsters early on. I'm assuming there might be something in there perhaps that talks about the prevention programs or what's offered.
I know Mapleton, and I think this is true of Crestview as well, or has been in the past, that we are involved in their first day of school or their open house.
Sure.
I will be at Mapleton tomorrow to have a table set up so parents can see some of the things, because if you're not in this field and you hear drug prevention,
Right.
especially drug prevention in kindergarten, oh my gosh, what does that
Right.
look like?
Right.
So we'll have our table set up with our curriculums and our puppet mascots and information, and of course a big bowl of candy
Sure.
to bring people in. So sometimes we send letters home before a program starts, especially with the younger ages, just letting parents know that this is this is the name of the program, here's where you can check it out if
Sure.
you want more information, but we're always available
Okay.
for people to contact us if they have specific questions
Yeah.
about what we're doing.
And Chris, you mentioned it. I think age appropriate is something you have stressed, all of you have stressed before, because that's one of those misnomers maybe folks have. Just what you said. What does drug education and prevention look like in kindergarten and first grade, right? Are they showing them needles? What is
Right,
going on? Are they
exactly.
cooking? What are they doing?
Exactly. Well, Wendy would be one to speak well to this because she does so much with the younger ages, but it's mostly a lot of social, emotional learning, coping skills, choosing your friends wisely, handling disappointment.
Yeah.
And all those things are building blocks, are resiliency skills, strong assets to build in
Yep.
kids so when they are in a situation where that might be an issue,
Yeah.
And one of our goals, our objectives in the prevention field is to delay the onset of first-time use.
Yeah.
And I think our Too Good for Drugs program, which is our evidence-based program that we use pretty comprehensively kindergarten through at least 8th grade, stresses
Right.
that delay of the first onset, because we know that first onset is an indicator of a problem in the future.
Yep.
Right.
We
Excellent.
want to
Yeah.
push that out.
What we do in the younger grades
Mm-hmm.
really sets the foundation for what's going to happen
Yeah.
as they get older. A lot of the times I'll talk to people about like what I am doing with
Right.
the little kids. And we're talking about those goal settings and how to manage emotions
Yeah.
and how to be a good friend and to recognize somebody who
Yeah.
is being a good friend to you.
Wendy, do you notice some of the parents' anxiety go down once you explain that it's what it is and what it isn't? Once you dispel some of the, doesn't their comfort level go up? Okay.
Yeah, I'll have people who ask me, well, what are you doing there? And once I explain that, especially like kindergarten,
Yeah.
we're talking, once we do get past those social, emotional kind of
Yeah.
things, we're talking about, how to stay safe with chemicals in your house,
And-
like your cleaning
and
supplies,
medicines, and
and
what's the difference
medicines.
between
And
Vitamins.
exactly.
Vitamins
We
and-
don't get into any
Right.
of the other things. Yeah.
Right. Well, I would imagine, because it's just one of those misnomers people just don't
Yeah,
know. And,
yeah.
and I think you guys have talked about this before, but the relationship between some of the social emotional and prevention, they don't always see that connection.
Mm-hmm.
And, Chris, you articulated it very well, but that's one of the things I think parents, especially at the younger ages, you kind of have to lay the groundwork
You
for
do,
them.
yeah,
And then
definitely.
I don't know to what extent parents can be a help in the home environment, right?
Mm-hmm.
To what extent can they amplify or support your efforts that in the classroom at home? Is there much thought about them helping you all do your work when they're in the home environment? So this is the kind of things we're doing when they're in our classes. I don't know if there's something that they can say, and help support that, any of the messaging when they're at home in similar situations, or can they just make sure that they don't have the prescription medications on a counter that's accessible, or I don't know how I just wonder how parents can help support the work that you're doing that's so important.
I think continuing to talk about that at home, outside of school, just being safe with your medicines, whether they're over the counter or prescription.
Yeah.
One of the things I'll tell kids, honestly, all the way up to 8th grade, is I know that as you get to a certain age, your parents will say to you, "Yeah, you can go get the ibuprofen or you can go get the Tylenol. It's fine." But you want to make sure an adult knows what you've put in your body.
Yeah.
Because if something happens to you and you have to go to the doctor, you have to go to the hospital, they're going to ask, what medicines have you taken?
Sure.
And somebody may need to answer for you. So those are important things. It's not that you need like them to go get it for you
Sure.
and hand it to you as you're a 14-year-old, but just letting somebody know
Yeah.
what you've taken is important.
Yeah.
And on the other side of that, I think parents could help by supporting them, by teaching them how to handle these emotions. Because when we get them in middle school and high school, if you were to ask a teen, why did you start using? It's usually because I was stressed, I was depressed, I felt left out, I was disappointed, I was bored. It's usually linked to an emotion.
Right.
Yeah.
And, adolescents do not know how to handle those
Right.
Sure.
big emotions.
And on occasion, when we do like meetings out in the community or presentations out in the community, and it's a touchy subject to ask parents to look at their own use,
Yeah.
because we can talk all day long about the effects on your social life, the effects on your body, on your brain, and we do a really good job doing that, but when they go home and they're seeing the total opposite of what we talked about.
Yep.
So I will say, you know, like I said, learning how to handle stress. If you are stressed and you are freaking out, and interesting, one of the questions by 6th, 7th grade I will ask when we do our lesson on stress is, and I always make sure that the kids don't shout out people's names specifically. I'll say, how many of you know an adult who says, oh, it's been a really tough week, I can't wait to have a beer?
Right.
And
Yeah.
90% of the kids will raise their hand, and then they'll go, oh, that's my dad. That's, you know, so we just,
So that modeling,
absolutely, is huge, is
Yeah.
huge.
And
Yeah.
if there is, you know, alcohol use in the home, just being responsible with it,
Yeah.
I think can go
Yeah.
a long way with kids.
Yeah,
'Cause
they're-
there's a big difference between misuse and responsible use.
Right.
Sure. And kids are fairly observant. Is that fair to say? So,
Kind of going back to, you know, what do we do with those younger kids? And what's unique about our agency is that we have staying power. So we've been in, so we see the kids year after
Yeah.
year after year. It's not a new person. So when my kids that I'm teaching get to 6th grade, and I say, okay, why do you think we're talking about goal setting in a class about drugs? And they'll be like, well, or why are we talking about using alcohol and stress? And all of a sudden they'll be able to answer those questions like, oh, because people sometimes use substances because they don't know how to deal with their emotions. They are stressed out, or they saw their parents doing it, and it's so cool because they're like, oh, that's making so much sense now. You know, that's why we set goals, because when you have a goal, you're less likely to veer off the path. And if you veer off the path, then you correct quickly and get back on track because you're actively working towards something you want to achieve.
that's
or
great.
All like making good decisions, and a lot of them can share decisions that have not gone well in their
Yeah.
family.
And I mean, we've talked about this before, but decades ago, it was, if you did drugs, it's because you were a bad person. No, we now know it's just a bad choice.
Right.
Yeah.
And
And for some of you, it's bad genetics.
yeah, we go
bad
into that too
environments
as,
and things like that.
but yeah, just not going in there and saying, don't do drugs. Well,
Right.
why?
Right.
Now
Yeah.
it's, okay, it's linked to emotions, it's linked to
Right.
bad decision making. And if we can lay the groundwork, then when they do get older, it all really makes sense to them.
Back to the emotions part, one of the things that I've started talking to kids a lot about is anxiety, because that's a big emotion that everybody feels.
Yeah.
And trying to normalize that to some extent. There are disorders of anxiety, but not every person has an anxiety disorder.
Right.
We all experience anxiety, and that's normal. And trying to help them see that, you know, you don't get over anxiety by running away from it.
Right.
You
Or medicating it.
Or medicating it. You take steps into it.
Right.
So, you know, I'll start pretty young talking about, like, you know, maybe you have a book report or something you have to do, and you have to present that in front of the class. That's scary for the majority of students to have to stand up in front of the class. And one of the things that I talk to them about is, you know, how many of you think, I love being up here in front of the whole class, you know, like this is my jam.
Yeah.
And they're all like, oh yeah, you love it.
Yeah.
Actually, it's taken, this is taken time. Like when I first started, I was very nervous being in front of people. But the more that you step into something that makes you uncomfortable, that is safe, you grow in that thing and you realize I'm capable of a lot more than I thought I was.
Yeah.
And that takes you a little further for the next thing that brings you anxiety. And you
Yeah,
realize
that's
you're stuck.
encouraging. You know, from the board perspective to hear, because that really complements something that we've tried to emphasize through all of our partnerships, is that this whole we want to normalize some of these strong emotions that we all have and not medicalize them. So what you just said there, Wendy, is critical for young people to learn that everybody experiences these emotions from time to time. But, you know, the answer is to you know, lean into those, to walk through those, to not to run from those, not to believe that I shouldn't feel this way.
Right.
Whenever I feel this way, you know, that something's wrong, something's bad. But no, to understand, again, in the right context and right understanding that, you know, this actually means I'm living, you know, and there's an opportunity for growth. Because if we do that incorrectly, I can tell you, because I work a little bit with the college folks, and If that's not done well, you got folks coming in that have been on IEPs, and they feel like the accommodations should be that they should not experiencing any emotion to any degree that they find uncomfortable.
Right.
And that's not life. That's not real. So one of the things I try when I get the calls from the parents, it's like, Johnny's upset or Johnny's anxious or Johnny might be a little bit down, and I explore what's going on with them. He's having a normal emotional reaction to a normal life event, and sometimes abnormal life events if it's and so normalizing and knowing that you're all doing that. I hope the audience hears that should be an encouragement, because we need to be doing that. We need to keep doing that. So thank you for mentioning that.
Yeah.
And I think it's good to point out too. I know we all do a good job saying, not every time you're uncomfortable, not every time you're sad. It's not clinical depression.
Yeah.
It's not
Right.
diagnosed anxiety. But we do recognize, because we know we have students who really do have those
Right.
things going on. So we try to make that normal
Yeah.
too. Like, there's a difference between you got broken up with and your heart's broken and you're feeling sad versus clinical depression. If you can't get out of bed, you're not bathing, you're not eating, you have suicidal thoughts, then that needs an intervention. That needs some further exploration, not just, and I'm always like, are you really depressed? Or are you just feeling a little down?
Yep.
Yeah, I think
And I think that
Just
teasing
finding
that out is really important, because it's become, believe it or not, you guys know this better than I do, but it's actually become somewhat trendy to be anxious and
Sure,
depressed
yeah.
and to
It's
have
like
a
a
therapist
buzz,
and be
it's a
in counseling.
we are
buzzword for the
very
kids. And,
quick
yeah.
fix society.
Yes.
We don't want to do the work. We just want to take something that's going to take that away.
Right.
I'm not saying that all the time.
Sure.
But I see
But
that.
that's
I see that.
definitely
We're
happening.
in a
Yeah.
pharmaceutical populism.
Exactly. We've talked
culture.
about this in past episodes
Yes.
before, about the fact that we don't like pain. So anything that makes us uncomfortable, we want to run away from that. But actually, there's a lot of things that are painful that are good
Yep.
Right.
for us to push
That
into a
cause
little.
growth.
Yeah.
Right.
So now I'm asking you to put on your prediction hats for the 24-25 school year. What do you think the hot topics might be?
Well, I can tell you how our school year ended last year.
Okay.
So our hot topic, at least on Leanne's part and my part, was a new tobacco product called Zyn.
Okay. Could you spell that for me?
ZYN.
Okay.
And Zyn it's got zero tobacco in it. It's straight nicotine. It's a smokeless tobacco. But again, no tobacco, just extracted nicotine from tobacco. And it comes in different strengths, and you put it in your mouth. It's very thin, so very concealable.
White pouch.
And the residue, you do not have to spit out. And it's not brown and disgusting. So we are seeing it a lot in junior high schools because it's concealable. We're seeing a bigger tick in female use because it's not like spitting into an empty pop bottle. It's kind of, and it has a huge social media following. They have people on TikTok called Zinfluencers instead of influencers talking about the kick that they get from using Zyn. And what they don't realize, people who are using it, is that nicotine addiction is a nasty, nasty addiction.
Sure.
It's probably one of the hardest ones for people to kick. And nicotine is a cardiovascular constrictor. So you're running into, heart health, which I know when you're young and healthy and 15, nobody's worried about that. But that was that. And then also fake pills, fentanyl, and social media context, how that was how we ended the year.
Yeah.
So I'm thinking that's going to be right out of the gate this year too.
Yeah.
And then of course with now Ohio was up and running with legal sale of recreational marijuana.
Right.
I think that was problematic last year for us.
Yep.
And it'll be more so this year.
I wondered if you would say that. Now, follow up on the Zyn. Where do young people purchase this?
Gas
Sorry.
stations.
Yes.
Oh, so it is something sold?
Yeah.
Okay.
And Zen would be the one brand. I think that's probably the most popular.
Right.
Okay.
But there are several other brands. But it's
see.
just a smokeless
Nicotine pouch.
nicotine pouch. It's just a little white pouch. And the thing with that is, because of its convenience, you could essentially have a nicotine high all day long,
Okay.
which is going
Interesting.
to create that addiction much faster.
Yeah, Chris touched on this, but I don't think the general public, well, maybe they do. Nicotine addiction, as you said, it is one of the most challenging addictions to quit. And I know we talk about heroin and some of these other things, and people wouldn't think nicotine's right up there, but it is. It's extremely difficult. So, again, we're all about the delayed use or no use. So that's a little disturbing. So, what about Zen and knowing that, yes, the prescription, the counterfeit drugs and the chances of fentanyl being or another adulterant being in those substances, our community kind of dealt with that a little bit last year. I've told other audiences, unfortunately, 2023, we had our highest number of overdose deaths since that group has been monitoring overdose deaths. So in almost every instance, fentanyl was at least part of the picture. So I know you all probably touch on this. I know you had adjusted the curriculum actually a little bit ago to just include more around the opioids in including fentanyl, but it's just so dangerous. And it's so dangerous that it's in maybe fake medications that don't say anything about fentanyl. It says Vicodin or it says whatever, but it's actually the fentanyl. So for the young people, I just want to make sure that they know that.
I had a very interesting thing happen to me, and again, I'm 35 years into this. I have an elderly parent who has some prescription
Sure.
medications, and we had a pill that we weren't sure what it was, and my sister, who's an RN, said, hey, there's an app that you can, it's called Drug Identifier or something, and you pull it up and you can snap a picture and it'll tell you, and it popped right up with what the name of the drug was, and each drug has a number on it. So I was thinking, so if somebody were going to make counterfeit ones, would they put that exact same number? And they would, because it looks like the real deal. So if you were going to fake manufacture Percocet, Vicodin, Adderall, you could get those in. If you had a real one, you could get the branded number that correlates with that drug, which was terrifying to me. Because I was like, well, yeah, if it had the wrong number on it, because I was thinking for my kids that I know are using, to keep them safe, like harm reduction, could they go snap a picture of their pill that they were using to see if it's fake or counterfeit? But they wouldn't be able to tell because the counterfeit people would use that same number. So that's scary to me.
Yeah. And you mentioned marijuana. So we talked about this last year, but at that time, recreational marijuana really wasn't in force and in law and being sold. But I reported on another platform that it is now being sold in Ohio.
What was it, $11 million in
the first week.
4 days or something?
Yeah. So I think, and again, correct me if I'm wrong, but I think I wanted to talk about that because I believe last year even some of your youngsters were saying, how can this be bad? Because so many people are using it or it's being prescribed and now it's going to be a law. So I just thought that would make your jobs harder, that's all, for a certain age range of individuals.
You know, we treat it as a medication and we also treat it as alcohol. You know, we know alcohol, I shouldn't say everybody, a lot of people use it, but it's still not okay for a young person to use it. And then we go into the addiction and why do you have to be 21 to use alcohol? And then if we treat it like a medication, just because marijuana helps this person with this disorder, it doesn't mean everybody needs to be on it.
I see.
Just because Xanax helps someone with anxiety or Adderall helps someone with ADHD doesn't mean that every single kid in the school needs to take it. So we just treat it like that. It's a medication. And then if we're talking recreationally, it's just like alcohol.
I see.
You should not
Good.
be using it.
Yeah.
And we find different situations. Like there are some things that are appropriate for adults that are not appropriate for children. So like at our younger age, like what would happen if we gave all second graders driver's licenses?
Right.
And they're like, oh, that would be, and it's the same thing. Like there are some things that are appropriate for a grown-up.
Right.
But another thing that we've had to incorporate with our little kids our safe medicine practices. Like if you find something that looks like a gummy in your house, because quite often edible marijuana looks like a candy or looks like a cookie or a baked good, like just check with the grown-up in your house before you take, if it's not where your gummy vitamins usually are, so just getting that information out. And again, pointing that out to parents who may be having those products
Keeping
in
that
their
stuff
house, keeping them very
locked,
separate.
and because a lot of those gummies, one serving for an adult is like a fourth of that
Yes.
gummy, and if you have a toddler or a who just fruit snack
Yeah.
Pops
it
a
could be
couple
bad.
in.
Oh, that's, I get so disheartened when they make the edibles in the shape of some of these gummies. They make them colorful. They just make it look like candy, and you just know that there's just going to be some accidents because of that.
You mentioned before what parents can do to kind of support the education, and I think that's a big part of it. One of the things we found in some of we'll have tables set up at different events or whatever. We have a medicine and candy board.
Yes.
That we show and have kids and adults see, can you tell the difference between what's candy and what's medicine? And adults typically are just as surprised as kids.
Yeah.
That's medicine? Yeah, that is. They do look a lot alike, and especially as we're now entering into this whole idea of edibles in our state and that being legal, it will be things that aren't even just gummy bears, but like you said, cookies, whatever.
And the marijuana that's being sold now, it's especially in the form of edibles, it's not like 1970s marijuana use. It's straight THC, which your brain, no pun intended, takes a bigger hit, right? Like it just, and
it takes
especially
longer
in a
to get there.
Yes.
And then when it does,
And marijuana is technically now considered a hallucinogen because of
the THC is
so high.
And in our older grades, the kids who are comfortable with me will even say, like, it's not the same. Like, and I stopped because of a really bad experience. And I've actually heard a lot of famous people recently coming out saying, like, I don't know if you guys know who Post Malone is, but he hasn't smoked weed in a long time because he had such a bad experience. And he's like, it is not like it used to be.
Sure.
So we emphasize that as well. These THC levels are just outrageous.
And going back to like what Wendy said with the getting parents on board, I think it's super important to also be, again, everybody knows it and we think we're doing a good job, but we can always do better. Monitor what your kids are viewing on social media, things like that. I've heard a lot of talk of junior high and high school kids speaking of microdosing because there's been a lot of platforms out there where famous people are talking about the benefits of using, shrooms and psilocybin and all that kind of stuff. And if your kid is listening to that, it could just be curiosity or they're trying to come up with a plan.
Yeah, I think that is a topic we added last year, was the hallucinogens and the idea of microdosing.
Right, because it was all over social media platforms about got to try this, got to do this.
And anytime you have something like that on social media, it normalizes it. And so if it's normal, they are going to stop.
And there was a documentary trending on Netflix about it, which spoke of it in a very positive light.
Yeah.
And I watched it and I sent it to you and I was like, oh boy.
Yeah. Yes.
We need to go in and kind of counteract this this perspective they're showing.
Well, this is a Dr. Ashley and the Boss episode without, of course, Dr. Ashley. So they're just stuck with the boss. But I'm speaking with Chris Hickey, Wendy Lemon, and Leanne White, the prevention educators that work at ACCADA. And we're nearing the end of the episode, so I do want to bring out a few things, practical things. So my understanding is basically none of you have any schedules. You sit around at ACCADA with free time. You wait for people to call.
Yes.
So that's not the case. So tell us, how, what's going on? What does it look like? What do your jobs look like? Because I think you're pretty busy, and a lot of people may not know that you have a lot of things already planned for the entire year.
Right. Yeah. We have schedules that we keep pretty much year to year.
Okay.
Our schools expect us to be back about the same time next year.
And the curriculum, the Too Good for Drugs, and some of these modules, they go for periods of time, so different weeks and whatnot.
So just my schedule, for example, I'll be in Loudonville for the first 10 weeks of school.
Okay.
And then I'll start into some of my Ashland City elementaries for the next 10 weeks, and then I'll pick up the next ones for the next 10 weeks.
I see.
And then we're getting close to the end of the school year. So,
Right.
yeah.
So, if folks do need to get a hold of you, maybe for a special event or to speak and whatnot, I would just encourage them to do that sooner rather than later and have an expectation that these ladies, all three, have very packed schedules. It's not that they can't do some additional things, but just recognize that they're not sitting around, that they really have full plates. But is it okay to say that there might be a change? You might be getting another prevention educator this year.
Yes. Yeah, we just hired our fourth prevention educator. Yeah.
Excellent.
Yeah, and she'll be starting out this school
We
year.
were finding it very hard. Our objective was to be in every single class in Ashland County,
Yeah.
K through 6th
Yeah.
grade. And that was great until all the schools came on pretty heavy, and then we realized that we were teaching 11 classes in one day, and
Right.
running from here to there, that it was just overwhelming. And so we hired a new person, and we're looking forward to getting her up.
Yeah.
and
No,
running.
that's great. That's great.
But if somebody were to need to get a hold of us, if they called our office, then our office would give them our numbers to get in touch with us personally, because we're not sitting in the office,
Sure.
like you said,
So-
waiting for phone calls. So they would be able to give you our information.
And the ACCADA number, just so folks know, and I'll put this in the episode description, but it is the 419-289-7675. And again, we're speaking with Chris Hickey, Wendy Lemon, and Leanne White. So we're getting close to the end. So I just wanted to say if there's any additional parting comments. I know we're at the beginning of the year, full of optimism, full of hope, even though
Yes.
there's going to be some challenging subjects. Well, what final thoughts from each one of you you'd like to share to the audience before we wrap up?
I would like to see, and I'm excited to see how the phones in schools shakes out this year.
That's right.
a
Is
good
that
point.
is that
has
uniform
been-
across districts, or every district a
We
little
don't-
bit different?
I don't really
I
know
think every
yet.
district has to have a policy in place. That's what I heard. But I
you're
don't
right.
know. I think it's school to school what that policy. Like I know at Loudonville last year, no phones. They had to be in your locker. And it was amazing.
Yes.
Amazing.
Well, we were running close to the end of time, so I didn't want to spend a whole lot of time on it. But last year, if you recall, you mentioned and spoke about screen time, what you had observed with both directly and asking the students you're working with how much screen time in a 24-hour day, and it seemed like a huge chunk. And I think we all agree that, and the research, Jonathan Haidt's book, AIDT, Anxious Generation. I recommend that book because they go into the research on that. If we can reduce the amount of screen time, particularly during the school day, it's amazing. And this is what I hear, educators and even the young people, how the learning environment changes when they just don't have that ready access to their phone. So it might be a little controversial at first because folks are used to it, might go through a little bit of withdrawal, a little screen time withdrawal. But I just wonder because, I don't think it's uniform. So I think if folks have questions about what their policy, their district policy is, they just need to ask somebody in the schools probably.
Right. Yeah.
Okay.
And again, I would go back to parents and guardians to monitor and try to limit screen
Yeah.
time,
Right.
especially with the younger kids, because research
Yeah.
is showing that it's priming adolescent brains for addiction. So if the less they can be on their phones, the
Yeah.
mental health improves, social skills improve,
Right.
academic skills improve. So that's something, another topic that we talk about in class.
Well, let's plan on when we do our episode next year, make sure we talk on how did it go this first year with some of the districts and their policies with regards to limiting a phone. This will be a nice little experiment to see what you all in your roles hear from the students directly and what your observations are on that. I'm very curious to see what difference it does make.
Yeah.
Wendy, Leanne, any other thoughts before we wrap up?
The only thing I would say, just as I'm looking forward to the school year,
Yes.
one of my favorite things is getting back to seeing the kids
Yeah.
that I saw last year
Yeah.
and seeing them grow. And something that has been amazing me year after year is how much they remember.
Oh.
I'm only
That's
there
so
with them for
fun.
10 weeks, 10
Wow.
weeks, one day a week.
Yeah.
And, a whole school year goes by and here I am at the same time again. And the kids will say, I remember when, and
Yeah.
they'll bring up a lesson from the year before. And so I guess that's one of those things I
Yeah.
find encouraging. And, just as we say, we're laying a foundation. That foundation is there
seeds.
for what's coming. Yeah.
And I've been at various events where you guys probably don't know this, where I'll notice a young person call out your name or run to you, and they have an overwhelming. They don't throw things at you, but they have an overwhelming positive reaction. And what I love about that is, you know, in your own way, you're making school a fun place to be. You're reinforcing the idea that you can trust adults and that adults do care about you and it's okay to trust them and talk with them. So all that stuff is so critical.
We could do a whole podcast just on that.
Yeah.
I mean, we know that kids are healthier when they make connections with at least one adult.
Yeah.
That's key.
And what all three of you are doing, that's why I say it's you know, I certainly petitioned the board that we add that fourth position. It wasn't a hard sell. They know, and we hear about the wonderful work that you're doing. So let me, on behalf of the board, thank you again for another year of wonderful prevention work that I know you just did, but you got another year upcoming, and I really appreciate what you all three do.
Thank you for your support.
Yeah.
Absolutely. Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.